We've been doing several stories recently with people in La Crosse helping save lives using CPR. With the coronavirus going around, it's raising some questions if you can contract the disease by doing these life-saving measures.
News 8 Now's Tyler Jobe explains why taking action can mean the difference between life and death.
You may remember seeing this woman from earlier this week. Kathy Helgerson, who lives in La Crosse, helped save her husband using CPR after he suffered a heart attack last month.
Caller cannot get him to wake up. Is doing CPR now. Sounds like she's doing it better.
CPR is one of those things that's a fundamental life-saving skill.
An emergency dispatcher talked Kathy through CPR while they were on the phone.
It's amazing anytime a bystander, whether it be someone that knows the person or doesn't know the person, performs CPR when it's needed.
Kathy's actions helped save his life.
You can increase a person's chance of survival 3- and 4-fold.
Nick Eastman of Tri-State Ambulance says 70% of cardiac arrests happen outside of the hospital.
That's why it's so important for people to know how to do CPR and be willing to do it. It's as simple as putting your hands in the center of the chest. You want to put the heel of your palm right in the center of the chest, put your other hand over top. I like to interlace my fingers, keep your elbows straight, and just lean over, and you're going to start going straight down. If you have a metronome, you're going to follow it. If you don't have a metronome, you can do this to the beat of Stayin' Alive by the Bee Gees. Are you okay?
Even with the coronavirus, Eastman says there's not a huge concern about getting infected while doing CPR.
And that's especially true with hands-only CPR. If it would make you feel more comfortable, you could try to put a barrier between you and the patient's face.
Hands-only CPR is just one of several methods of training the American Red Cross is providing during the pandemic.
If they've had the training and then they can give CPR to someone in distress, to go ahead and do that. Because the threat of COVID at that point is not as dangerous as maybe what the person's going through.
But perhaps the biggest thing to remember, don't panic.
Sir! The greatest harm in a cardiac arrest scenario is to not do CPR. Even CPR that's done inappropriately or quote-unquote inadequately is still better than no intervention whatsoever.
In La Crosse, Tyler Jobe.
It's as simple as putting your hands in the center of the chest and pushing hard and pushing fast.
News 8 Now.
Eastman also says CPR should be done between 100 to 120 beats per minute. He says do not go any slower or faster than that and strongly encourages using an AED if you do have one available.
And for more information on how to do CPR, all you have to do is visit the Tri-State Ambulance website.